welcome back to the channel. So today we are going to discuss about myth versus fact in pharmacology. Do antibiotics cure viral infections? So just a question for you. You have a common cold with a runny nose and mild fever. So one of your friend told you that you just take the amoxicillin or the antibiotic, you will recover quickly. So would you take that suggestion? Many people would say yes. In fact, this is one of the most common misconceptions about medicines in the world wide. Today's myth is antibiotics cure viral infections. By the end of this section, you will understand what actually antibiotics really are and why they work only against the bacteria, why they fail against the viruses, and the pharmacology behind every major antibiotic classes, and the dangers of antibiotic misuse and how antibiotic resistance develops and few of the real clinical examples. So, the word antibiotic literally means against the life, referring specifically to bacteria. So, antibiotics are the drugs either kill the bacteria, that you can say bactericidal drugs, or stop the bacterial growth, that we can say bacteriostatic drugs. So, examples of bactericidal are penicillins, cephalosporins, and fluoroquinolones are the bacteriocides. That means they kill the bacteria. And in the case of bacteriostatic antibiotics, tetracyclines, macrolides, sulfonamides, and chlorophenicol, so they actually inhibit or the stop the bacterial growth. So remember, antibiotics are designed specifically to target the bacterial structures or the bacterial metabolism. So, to understand the antibiotics, first you need to understand bacteria. So, the bacteria are the living single cell organism. They possess cell wall, cell membrane, cytoplasm, DNA, 70s ribosomes, and metabolic enzymes. So, because bacteria have the structures, they become excellent drug targets. Think of bacteria as a house with many doors. Each antibiotic attacks different door. So it destroys one essential structure and the bacterium dies. So now compare the viruses with the bacteria. Viruses are much smaller than bacteria. They are not complete cells. They actually contains genetic material, that means our DNA or RNA, protein code, that means the capsid, sometimes an envelopes. So viruses has no cell wall, no ribosomes, and there is no independent metabolism, even no energy production. Instead, the viruses enter the human cells and hijack the host machinery to reproduce. Imagine a virus as a computer hacker. Instead of building its own computer, it enters your and uses your system. So this is why antibiotics cannot affect the viruses. So let's understand the mechanism. Cell wall inhibitors that we already have studied in the antibiotics. For example, penicillins, cephalosporins, carbapamines, and vancomycin. So their mechanism of action, they actually prevent the peptidoglycan synthesis, right? So without cell wall, bacteria burst due to osmotic pressure. So the question for you, do viruses have peptidoglycan? No, right? So therefore, this drugs cannot affect the viruses. So in the case of protein synthesis inhibitor drugs like macrolides, tetracyclines, aminoglycosides, chloramphenicol, they all having the mechanism, they actually bind the bacterial 7 ribosomes. So they prevent the protein synthesis, and in the case of viruses, they have no ribosome. They use our ribosomes. So again, antibiotics have no target. In the case of DNA synthesis inhibitors like fluoroquinolones, they inhibit the DNA agarase. So metronidazole damages the bacterial DNA, and viruses don't possess any bacterial DNA agarase. So therefore, thus antibiotics cannot work. In the case of folic acid synthesis inhibitors like sulfonamides, trimethoprim. They actually bacteria synthesize folic acid. Humans obtain folate from the food, and virus don't synthesize folic acid. So again, antibiotics fails here. So the viruses require antiviral drugs. For example, influenza, that oseltamivir or herpes acyclovir, HIV antiretroviral therapies, hepatitis, tenofovir. So even the COVID-19 for the selected patients, they have went with the antiviral agents where which indicated that time. And each antiviral targets a specific stage of viral life cycle, such as viral entry or genome replication or viral enzyme activity. Unlike the antibiotics, antiviral drugs do not act on any bacterial structures. So, this is one of the most important topics in pharmacology. Suppose a patient takes antibiotics unnecessarily, most bacteria actually dies. So, however, a few naturally resistant bacteria survive. Thus, resistant bacteria multiply and pass resistance genes to further generations. Common mechanisms like enzyme production, that means the beta lactamases, modification of the drug target, reduced drug uptake, increased drug efflux, biofilm formation. So eventually, antibiotics that once worked become ineffective. Examples includes MRSA and VRE, ESBL producing bacteria, and carbapenem resistant organisms. So the antibiotics resistance leads to longer hospital stays, higher treatment cost, and increased mortality. So I will tell you one case. A 22-year-old patient has fever, cough, runny nose, or the body pain, and test is positive for influenza virus. So, should antibiotics be prescribed? No, right? So, the illness is viral. So, supportive care and where appropriate, the antiviral therapy are considered instead of antibiotics in this case. So, just again, after 5 days, the same patient develops high fever, chest pain, productive cough with the thick sputum, and chest X-ray findings suggestive of bacterial pneumonia. So just imagine now are antibiotics indicated? Yes, right? Because a secondary bacterial infection is suspected in the case of second case. So the antibiotics therapy may be appropriate after the clinical evaluation of this case. So let's review today's key points. So our myth was antibiotic cure the viral infections or not. So the fact antibiotics works only against the bacteria because they target only bacterial cell walls, ribosomes, enzymes and metabolic pathways that viruses do not possess. So remember this exam points always. Antibiotics do not treat viral infections. Misuse contributes to antimicrobial resistance and always use antibiotics only when clinically indicated and prescribed. So, understanding the mechanism of action makes the pharmacology easier than memorizing the drug names. So, thank you for watching. If you enjoy the episode of Myth versus Fact in Pharmacology, like, share, and subscribe. In the next episode, we will discuss another common pharmacology myth and uncover the science behind it. Thank you.